relationships as an alliance with those organizations, and they're very supportive of school-based health centers, even though our field is a very small part of their overall provider base. You know, they actually, the head of the Medicaid plans will actually take my phone calls and take meetings with me, and we really, in the grand scheme of things, we're pretty small potatoes, but they actually believe in improving adolescent health care and feel like school-based health centers are a way to do that. So I think we're really lucky in that respect in our state.
Nancy, this is Serena. I'm going to set a dangerous precedent and ask you a question, but I'm pretty sure that other people will be interested in the answer to this. So what, have they actually done something specific? Like, do they give you grants? Do they do particular type of reimbursement for school-based health centers? Like, what does their tangible support look like?
All kinds of things. We actually have, we run a quarterly meeting for on contract with our Human Services Medicaid division, and the school-based health center field has representatives there, as well as representatives from all the managed care organizations, and we literally sit for 2.5 to 3 hours every quarter, and sometimes we have meetings in between, and do things like brainstorm around how to make coding and billing easier for school-based health centers, or how to capture data to show the care that's happening at school-based health centers without a place of service code. You know, one of the things that's really happening on a high profile in our state right now is looking at teen pregnancy prevention, since we are always #1 in that area, the pregnancy part, not the prevention part. And they actually are looking at partnering with us to try to tackle that issue. And on top of that, I'd say every 3 years we get unrestricted funding from all of those managed care organizations on the order of anywhere from $2,000 to last year $10,000 from one of them. And, you know, they'll do other smaller things like provide in-kind donations for events, that sort of thing. So I think on the whole, it's a really positive relationship and very solution-oriented.
Okay, cool. Thank you very much. That's really interesting. I hope that we're going to talk more about this. All right, let's keep moving westward or north from New Mexico. Sorry, I meant eastward, but I'm sure you guys can figure out who's next. It doesn't matter. Somebody just go.
Oh, Stephanie.
Hey, I would say for North Carolina, it's the longevity of our school-based health centers and the quality care that they provide, and I think the longevity reflects the strength of our partnerships, not only at the state level, but also in our individual communities. And I just want to give a quick shout out to Wilmington Health Access for Teens. They celebrate 20 years and have a big celebration planned for tomorrow in their community. So 20 years of school-based health centers in Wilmington, North Carolina.
Hey!
Yeah, I know.
Connie, is that Connie's site?
Yes.
That was Connie's site. Joy Grady is the current executive director in Wilmington,
Okay.
but those were the sites that Connie helped to start.
Cool. That's great. Thank you.
Uh-huh.
All right. It's a free-for-all now. We're already on the East Coast, so just nominate yourself.
Say Nicole or Sarah? Anyone there?
Hi, this is Nicole from Maryland. I guess I would share that we've been really focused on strengthening our leadership at the state level for school-based health centers, and we're fortunate to have two really strong legislators who are champions for school-based health. It took a while to kind of regain some champions, both in the House and the Senate. So we're excited to have them on board, and they've been already instrumental in helping us get some very positive pro-school-based health center legislation passed at the state level, and we're looking to kind of continue and build on that going forward.
What was the legislation they passed, Nicole?
We formed a statewide council to study the sustainability of and the infrastructure for school-based health centers at the state level, and trying to sort of both correct and improve the type of support that the State Department of Education and the Department of Health and Mental Hygiene are providing to school-based health centers.
Right. I remember you talked about that, and that was done through a bill.
Yeah. And they were key to that, and they continue to be champions for us. So we're trying to move it to funding and resources, but right now just having that council in place will be a big first step.
Right. Great. Thank you.
Marina, this is Jesse. I just wanted to let you know that I joined.
Well, go ahead. Give your update.
Is that what you're doing? Just updates on what's going on?
What we're doing is, what is one thing that is going well in your state? What's a strength in your state? Something that's happening in the field, program, policy, funding, anything, something that you feel like is a strength in Connecticut.
Okay. Well, I think for us, it is for school-based health centers in particular, it is a pilot project that we're doing to pilot these person-centered school-based healthcare model, which is modeled on a PCMH, but specifically for school-based health centers. We've had 2 sites participating now since last January in this pilot project, and it's going very, very well. And one of the sites in particular, has been able to achieve, I think, so much of the documentation that would be needed, even if they were trying to apply to be a regular medical home, that they're doing incredibly well. And what it's really showing is how high the quality can be in a school-based health center, and how they really can manage the care quite well for students that are enrolled. So that's doing well. We had a really nice site visit. I think this happened after our last state call. We had a great site visit. John and Suzanne came to Connecticut, and we put a policy team together. And we even had our state Medicaid director there and talked about this project in particular. And so I think that's something that's going really well for school-based health centers in our state.
Great. Thank you.
Welcome.
This is Sarah. Does that mean I'm up?
Yeah, you're up.
Hi, everybody. Sarah from New York. I would have to say that we have a couple of areas of strength. One being, obviously, our size with the number of school-based health centers we have. But more importantly than that, I think, is the size of some of our sponsoring organizations and the level of sophistication that we have access to because of that. The ability to do research, the ability to pull together teams that are multidisciplinary, and the fact that because we can pull from those as our resources when we do speak in terms of school-based health and its impact, we have a fairly sizable impact on the legislation because of it. For instance, I'm going to a school-based health center opening tomorrow. It just happens to be in Cooperstown. It's Bassett, one of our bigger groups. And there will be a senator and 2 assemblymen there who I'll be able to go rub elbows with. And it's because of the fact of the impact of the size of Bassett and the mouthpiece that Bassett can be just for Central New York. So I'd have to say our size and our sophistication really is where strengths lie in New York.
Thanks,
I think you're doing some leaf peeping while you're up there, Sarah.
I sure am, John. It's beautiful in Cooperstown right now.
Oh, that's beautiful up there.
Hey, anyone else? Okay, how about the National School-Based Health Alliance? I guess the question for you would be, like, what do you see as a bright spot that you're feeling right now?
Well, so I'll start. This is John, and you're going to get a preview of it from Haley today around the performance measures. But I do think the Maternal and Child Health Bureau really gave us an opportunity to be bold and audacious in thinking about our performance measures. We never really sort of staked out a specific number around the growth in the field and the documentation of data in the way that they have challenged us to do that. And I've been very pleased with the response from the field in the participation of the selection of those performance measures, in the energy and enthusiasm around participating in the quality improvement and sustainability collaboratives. So I feel like this body of work, and I don't want to suggest that anything else we're doing isn't as important or as significant, but this moment in time feels very important to us, and I think we're on the path to doing something very significant. So I'm very excited about the launch of performance data set and the quality improvement collaboratives, and I welcome my colleagues to offer any other bright spots they see.
This is Serena. I'm sad to say this is my last call with you guys. It's been great working with you all, but I just came back from Oregon. I was at their conference, and they're too bad they're not on the call today, but they're doing a really cool utilization initiative between public health, Medicaid, and a local school-based healthcare system to really take a look at what services are happening at a school-based health center and have it be really data-driven discovery between these different partnerships. So I think it's really exciting work, and hopefully Oregon can share more about that as they get off the ground with that work. But I think it's a neat way to kind of engage different partners to really understand what school-based health centers, what kind of care school-based health centers are delivering. So that work excites me, and I think there's something we can learn from that and perhaps even replicate some of that work in other states and other communities.
My other colleagues just introduce themselves so they know who else is sitting at the table. That would be nice.
Sure. I'm Larry Bastian in development. Hi, everyone.
This is Haley Gov. I'm the Director of Research and Evaluation, and I'll just sort of bounce off what John said, but just more broadly I think that we're thinking really hard about school-based health center data and how the data that we're collecting from the health centers be more actionable, that it doesn't go into a dark hole and disappear for months and months at a time, and really thinking about how we turn the data around to the field and make it useful and actionable. So we are going to be working with you closely and on all of our initiatives, but really focusing on that piece.
Hi everyone, again, my name is Tiara Brooks. I'm the Administrative Assistant for Programs.
Hello everyone, my name is Esther, and I am a Communications Helper.
And Andrea, were you able to join us yet?
Yes, hi, this is Andrea Shore. I'm the Director of Programs.
Right, and Andrea, I already announced that you are the interim liaison between so we've shared that news already.
Great. Okay, thank you. I've met several of you at convention and in other conversations, and I look forward to working with everyone.
Okay, thanks everyone. You guys have a lot of people over there at the table. It's great to hear all of your voices. So I am going to turn the agenda over to Serena Reckling now. Is that okay, Serena?
Yep. The next item on the agenda was...
Serena, before I turn it over to you, I want to, first of all, thank you and say that I am super sad that you are leaving. You have really brought a lot of life to our group, and I think we all really appreciate it. So I'm glad you're not going far, and I hope that you will still be thinking about school-based health centers and someday may return to our field or maybe even move back to your home state of California.
Thank you, Serena, and I'll let you know if I ever decide to move back to the West Coast.
Here. And then can I just do one quick agenda check? And Nancy had asked that we have something on the agenda about awards programs, and is that on the agenda?
It is on there, yeah.
Okay, great. All right, then I'm going to put myself on mute and keep driving, and thank you so much, Serena.
Great. And I just want to say thank you to all of you guys. You've been the highlight of my work here, and I'm going to be sad not to be as plugged in with what's happening in all these different states, but we'll definitely keep in touch. I'm still in the child health world. If you guys ever have any questions about Medicaid, feel free to call me. And I will be advocating for school-based health centers in Washington, D.C. So thank you all. And so the next agenda item was committee updates. So I don't know how many of the committee chairs are on, but perhaps I know communications, there's someone on, Kyle, I think. So if anyone else, if all the committee chairs or someone from a committee that was on the committee breakout session last week, if you guys want to provide an update, that would be great. I know communications and national definition did meet last month.
Yeah, is Marcel on the call? If not, I can give a brief update.
It doesn't look like. Oh, there he is. Hi, Marcel.
Hi. Not much to update. We did have our call, and I've been uploading some reports, some really great reports that have come out in the last month on attendance that have some really great statistics about health being both a challenge and solution to attendance. And we're really trying to put together some facts, some quotes, some statistics around attendance and around education that everybody can use to kind of make their case in their states. Everybody, I think, is I think everybody's in a position where they're really pressed for resources and time, and so I am trying to kind of create something that we can use and have as a resource and kind of be able to use as a foundation for us to put our message out there. And I got some resources from some of the folks on the call. Allison, Sue, and Nancy were on the call when we met last week, and I'm looking forward to continuing this discussion and moving this forward after our call today.
Thank you. Any questions about the Communications Committee and what they're kind of working on? Great. And now, perhaps, Stephanie, could you talk about the definitions and standards work? I know you've been talking to Tammy.
Sure. And actually, I think we sort of focused more on our last committee call on telling our story through data and how we might use or take a look at what each of the state alliances are doing already in the way of either annual reports where they share their data or some other kind of, whether it's annual or less than annual summary of data that they share with their key stakeholders locally. And so we said that we would upload those into the common area so that folks could take a look at what's already being done. And then we would sort of evaluate possible next steps for how we might do that collectively and perhaps more efficiently across states. So that was one of the things that we talked about. I still can't log in, so I need to probably get with you, Serena or Kyle, maybe to figure out how to log in. It still doesn't recognize me, so I can't tell you if people have actually uploaded those documents that I just mentioned, but that was really the first step that we talked about. And then Tammy and I actually had a call since our bigger committee call, and we also noted that the SBHA has the report card format that is fairly user-friendly, and that some states are using that as a way to report their local state data, or they're using something like that to report their local state data. So we talked about adding that into the mix of things that we look at and review as a committee. And Serena Clayton, I know you were on our call. Sarah, I think you were on our call, so if others want to chime in, please feel free.
Stephanie, this is Serena, and I'm really glad that you gave that report and that you and Tammy met. I have to confess I'd actually kind of forgotten what we talked about, so that was really helpful. And I just want to be really clear so that I know that we've done it and also so that everybody else can do it. We were going to upload full of annual reports, fact sheets, whatever type of publication it might be, where we had used data about the school-based health centers in our state, not like other people's research, but like our own school-based health center data.
Right.
Okay. So it might be things like how many there are, what kind of services they provide, or any kind of outcomes that we collect. We don't collect any of that in California, but just theoretically, if people did, that's the kind of data that we're talking about?
Right.
Okay, that's really helpful. So I don't know if we've done that or not, though. And we have very little because we don't have much in the way of data, but we'll definitely upload what we have.
Okay, sounds good.
Thank you.
And then I think Tammy and I weren't quite sure where the SBHA report card format is on the new website. So Serena, if you have a link to that or can point us in the right direction, we could maybe upload that for folks to take a look at too.
Sounds good. Great. And the telehealth committee did not meet, and it doesn't look like anyone from the telehealth committee is on the call, so no updates on that. So now I'll turn it over to Haley to make the big announcement. And then, Haley, if you can give us 10 minutes, so 10 till 1, so that we can get to Nancy's agenda item, that'd be great.
Absolutely.
And while Haley is queuing up the slides, I want to extend my thanks to all of you. I know many of you participated in the census process. Our state affiliate leaders, in fact, one of our strongest representative groups in the Delphi process, as were the state program offices. Several of the state government agencies that run school-based health centers showed up in a big way. So thanks to all of you, specifically I know Tammy Alexander, Kathy Canatelli, Serena Clayton, Ruth Ellis, Heidi Alviar, Jesse White-Versay, and Francie Walden were all participated in the process. So several of you might have seen this presentation already, because we have released the findings to the group who participated in the Delphi process. So for some of you, this will not be a huge surprise, but this is also new information for the rest of you. And before I say go, Haley, I also wanted to telegraph that in the next year, it will be our goal to work with those of you who have state program offices in a very concerted effort to align our data with theirs. We'd really like to, as much as possible, like to try and find some alignment between the states where they are already collecting data. And so we're really going to be looking to you in partnership to advocate for that, so that all across the country we're all reporting on the sort of same quality data indicator. So we've got, Haley will share with you sort of where the states are at this point. We're not that far off from many of them, quite frankly. There's terrific alignment. So it'll be a small nudge in some instances and a larger push in others. But we really feel like that's going to be the most expedient way to get to that 50% mark, which the Bureau is counting on us doing by the end of our grant in 2018. So this is a thanks in advance to you for partnering with us and really pushing on those measures as we begin the very challenging work of the data collection effort. So take it away, Haley.
Thank you, John. And I just want to echo my thanks as well to all of you who participated in the process of prioritizing a set of performance measures for the field. It was 6 months of continued engagement and participation and feedback, and everything that you all provided made for a very rich experience for everyone involved in the process. So we really value the time and commitment that you made to this process, because it's what made it a strong process. So I'm going to share the results of what we came to through this 6-month process. So as those of you who participated in it, some of that richness that I'm talking about came from the diversity of individuals who participated in the process of scoring and a proposed set of performance measures for school-based health centers. It was state affiliates, representatives from state affiliate offices, state program offices, representatives from our board, national child and health advocates and leaders in the field, evaluators, our board members, a really nice, rich group of people, all bringing different perspectives. And payers were another group that we were very fortunate to have involved because each one brought a different lens. What we were so excited about, impressed by was the continued participation through the 3 rounds. We had 90 individuals in the first round, 69 participants in the second round, and 72 participants in the third round. So for those of you who didn't participate in this process, we used something called the RAND Delphi process, which is a method used to come to consensus on performance measures. It's been used by various groups to come to consensus on quality measures for school-based health centers, including the CHIPRA core set. So when I talk about rounds, in each sort of step, which is described as a round, the participants scored the measures. And what we came out with was a set of what are 5 core performance measures for school-based health centers, which you see on your screen. And you can see the how they scored by the participants. So the top measure was annual well-child visits. The second was depression screenings. The third is annual risk assessment. The fourth is BMI assessment and nutrition and physical activity counseling. And the fifth is committee of screening. So we have determined that these will be our 5 core measures for school-based health centers. They will be our priorities as we start this initiative. I'm going to share the results from the other measures that were considered and share that they haven't been they haven't been thrown away, they've just been moved to a parking lot. We know that the success of this initiative lies in starting small and realistic and then expanding the set. So these 5 measures are where we're going to start. And these are also the 5 measures where more than 50% of the group who participated in the process of scoring them rated them as, the top measures to represent the field. So these are the results of the other proposed measures. There were 10 in the whole list. And so here you see the results from adolescent immunization status, asthma action plan, alcohol and drug use screening and counseling, tobacco use screening and cessation assistance, and HPV vaccine. So like I said, these are on hold for a period of time. We're going to start with the other measures, but here you can see the results of how these measures scored by the group. And here I want to share the results of what were described as stretch measures through the process. So the core measures align with National Child Quality Measurement Framework. So as you could see on the previous slides, we use the definition used by HEDIS or UDS or CMS for the definition. But then we wanted to think about what are those measures that can really show the uniqueness or the value add of the school-based health center model. What makes us special? What's the unique contribution? And so a lot of thought went into this process with the participants of what those qualities of school-based health centers are that we would want to highlight and collect data on. And so we grouped these measures into 3 approaches. The first is an SBHC client survey, which scored the highest as an approach to collecting data to demonstrate this uniqueness of the school-based health center. And in this approach, we'll be building a standardized confidential survey and asking individuals who use school-based health centers to reflect on their experience of care, their relationship with another, whether they use a school-based health center as their usual source of care or how they use the rest of the healthcare system, questions about self-efficacy and health literacy, and questions along those lines. The second stretch measure approach is a client disposition log. This has also been described as a seat time log. And so looking at how school-based health centers reduce absenteeism among children and reduce unnecessary early dismissals from school. So keeping kids in school longer. This measure probably speaks most strongly to our education partners, and that was one of our it was set out for us by the Maternal and Child Health Bureau that we need to have measures not only documenting health, but the impact of access to a school-based health center on educational outcomes. And the third approach is an SBHC policies and procedures survey to document sort of various policies and procedures that should be in place for strong school-based health care. All three of these stretch measure categories scored above 50% by the participants. And it's in our COIN, which I'm going to be talking about very, very soon, where we're going to test out these measures. So COIN stands for Collaborative on Improvement and Innovation Network. So there are some measures where we're focusing on improvement, and some measures where we're focusing on innovation. The improvement measures are our 5 core performance measures. Like John said, they align so nicely with so much of the work that's already been done in the field. But what's exciting about a COIN is that there's an innovation space as well, where we have the opportunity to test out something new. So I'm going to spend the next 3 or 4 minutes just talking to you all briefly about how we plan to engage the field in the National Quality Initiative during the 2015-16 school year. So as we've shared with you on numerous occasions, that MCHB has set out ambitious objectives for this initiative. They want to see 25% of school-based health centers adopting, documenting, and reporting performance measures by 2016, and 50% of school-based health centers documenting and reporting performance measures by 2018. So our goal for the next year is going to be to engage key stakeholders in the process of adopting and reporting these standardized performance measures for school-based health centers. And our 3 target audiences for some of this work on the ground and strategic thinking are the participants in our COIN, so the NQI COIN teams, the state and regional program offices, and yourselves, so the state affiliate organizations, as well as continuing to engage participants in the measure prioritization process who have shown such commitment to wanting to be engaged in shaping this work. So as you know, the field was invited to participate in this learning collaborative that I've been talking about. We received fantastic applications. And here on the screen you can see who are the NQI COIN teams who will be participating in the first cohort of the initiative. There are 2 arms of the COIN. One is focused on standardized performance measures. The second is focused on sustainable business practices. And so we have 8 teams participating, representing 2 School-Based Health Alliance state affiliate organizations, 4 state or county departments of health and public health, 22 sponsoring organizations, and more than 60 SBHCs in 8 different states. So this group represents a really nice geographic diversity and diversity in many other ways, and all of them showing an exciting high level of motivation to be a part of this work. So for our NQI teams, they're going to be the guinea pigs in this body of work. Our goal is to lead them in adopting, documenting, and reporting those 5 core performance measures, as well as engaging them in that innovation work with our stretch measures. We're going to work with the sites to use the data that they're documenting and reporting monthly to accelerate quality improvement, with the goal of documenting lessons learned from the COIN and disseminating that information to the field. But if you think back to those percentages that I shared just a few minutes ago, the numbers of people participating in the COIN don't get us too close to those objectives set out by the Maternal and Child Health Bureau. About 3% of the school-based healthcare field are participating in the COIN. However, there are about 20% of school-based health centers in states across the country that are currently required to report many of those 5 core performance measures that align with the national 5 core performance measures. So as John mentioned, what we're going to be doing over the next several months is starting by engaging with the state and regional program offices and state affiliates, where we see considerable alignment between where many of you are already documenting and reporting this data to a state program office, and working together to build a strategy collaboratively to align the definitions of the measures so that we are all shooting towards the same target. So our objective with you all over the next several months will be to host individual discussions with representatives from the state or regional program office and the state affiliate organization to discuss the process and create strategies for aligning state measures with national measures, to discuss those supports, resources, and incentives needed to adopt and report the measures, and discuss the logistics of reporting that data to a national data collection system led by the School-Based Health Alliance. And like John was saying, we're looking to all of you to be to support us and be advocates for this approach. The power of a national data set to be able to describe the work that we do is really what we feel can help advance the field right now. So I'm going to finish off by saying thank you for those of you who participated in this process and what you committed and how far we've come in a short period of time, and to thank you in advance for the work ahead of us. We really look forward to partnering with all of you and hearing and learning from what's going on in the field to start to advance this work together. So I'm going to wrap up there and turn it back over to Serena for the next steps.
Thank you. So now I wanted to turn it over to Nancy. And Nancy, I know you wanted a time on the agenda for your question. So go ahead and ask it to the group.
Sure, and this is very brief. Our state and actually California as well, and we've met with the California State Alliance folks, are doing some internal state awards. In our state, we actually sort of simultaneously to the process SBHA was involved in creating a definition, created our own state definition of a school-based health center, and we now have a work group or committee further working on criteria of an exemplary school-based health center. So we are working on designing an awards process, the criteria of process, and then we have an annual conference and meeting in April, and we'll be looking to recognize some of our school-based health centers who we feel like meet that exemplary criteria at that annual meeting. So we just wanted to check in. We knew that California was working on something similar, but we just wanted to check and see if there were other state alliances that do something similar that we could learn from, whatever their best practices and processes are, rather than recreating the wheel. So this is just sort of a request for any information you guys have if you're doing something similar. Don't everybody chime in at once.
You guys are cutting edge.
Well, if anyone thinks of anything similar, if you do something, or if you know that you do something similar in your state for school nurses, or have any ideas, just shoot me an email, and we're going to continue working on this with California a little bit. I think our school-based health center awards are going to be for the centers themselves, and we'll be trying to honor the staff as well as the sponsoring entity in our state. And I think California is looking, and Serena, feel free to share more, is going to be looking at things that are more specific, like a provider award and that sort of thing. And we're looking at everything from what the application process would be like, what the trophy is going to look like, to, you know, would we have an on-the-line application process or what? In our case, I'm pretty sure we have a board past president's committee, and I think those are going to be the readers of our applicants. So we have, I think, that part figured out, but the rest of it is a bit up for grabs. So if anybody has any ideas, feel free to share. We'd love to hear from you. And thanks, Serena, for giving me this time on the agenda. And I just want to echo what Serena said. Even before you were the state leader liaison, you were so helpful to our state with the support of patient-centered medical homework through CHIPRA. And we're going to miss you, but good luck in your new adventure.
Thanks, Nancy. So I think that's it before we turn it over to committee breakout sessions. So is there any other comments, thoughts, anything that anyone would like to share, either from what they've heard over the past hour or something else that they'd like to bring to the call?
This is Sarah from New York. Sorry, I couldn't chime in time. Nancy, I could give you a call. That's actually something that we're working on as well, as recognizing our school-based health centers. We happen to do something right now that's similar, but it's more specific to advocacy, so I can let you know the details of that, how we've done it, and just, you know, I could show you the awards that we've used. But I could give you a call if you'd like.
That would be great. And Sarah, I'm actually going to ask you to talk to Kim, because I know we have it on our agenda to talk to you guys about the EOB work going on in your state as well, so maybe you guys can kill two birds with one stone.
Sure.
Thank you.
This is Serena Clayton again, and I apologize for the background noise, but you know, there was a little blurb that went out in the Scoop, I think it was last week, and I just wanted to find out if anyone, this is about the FERPA issue. I don't know if it was really that clear in what went out, but the National Center for Youth Law, which happens to be in Oakland right near us, but they're a national organization, we're looking for examples where FERPA had allowed for the release of medical information to parents or another entity that was problematic. Because there was a case here in California, I think it was in California, where this happened, and I can't remember the details, but I just want to make sure everybody saw that. And they, in order to advocate for change, to even get the issue kind of on people's agenda, they need some examples. And they can talk about the issue theoretically, but they really want a few cases where they can point to what, I guess, what a reasonable person might agree was inappropriate release of information, even though it was allowable under the law, but highlighting the problematic nature of HIPAA and FERPA and the lack of protection in certain cases to try to come up with a better policy around health information connected to schools.
Serena, this is Nancy in New Mexico. I don't have record of an identifiable case where that was a problem, but you probably already know that our state, I think it was 7 years ago now, the attorneys for our state Department of Health that funds more than half of our school-based health centers decided that the fear of that possibility was reason enough to not allow any DOH-funded school-based health center sponsoring entity be a school or school district. So they had to scramble, and all those school-based health centers in our state that were sponsored in that way had to find new sponsors. And so they radically changed all the contracts through our State Department of Health because of that legal advice. We used to have quite a few that were sponsored by schools, and now we've had to bring folks like regional educational cooperatives and local community foundations into the field to fill that gap. So I don't know if that's helpful, but I could put you in touch with someone who knows more about that history, or put Rebecca in touch with someone if they thought that was useful information.
Okay, that is interesting. I guess we actually might be, I think we are a little bit unusual in California and having quite a number of school-based health centers that are sponsored by school districts. So this may not be as much of an issue in other states. But I guess I wanted to make sure that everyone saw that, and if you had something to share or could direct them to someone that might have a story that you did that. They're on a kind of a short timeline. I'm not sure why.
Thank you. Well, any other comments? Perfect. So we have the next half hour reserved for the committee breakout sessions. I have on screen the conference call lines. So I am not sure if there's anyone here that's calling into telehealth, but if you're one person calling in, you could call in and see if anyone else from your peers will join. But I do know that there are a few of you that are in communications and standards and measures that are on the call today. So now's the time for everyone to hang up and call in that number and continue the wonderful discussions you started last month. Thank you so much, everyone.
Thank you.
Thank you.
Bye.